Good evening to our listener. Sorry for a bit coming late. Let me use this time to say welcome to another edition of our program, Field Health Hour, here on Radio Kepamas, 92.1 megahertz, with your regular presenter, Aze Menduaba Blair Jr., volunteer at Progressive Health Initiative of Liberia. Last week we were here and we discussed some topic, and today we have come to look at some major, very important topic, breaking the silence on mental health. We were here with this, we talked about just abuse and effect, where we talk about substances that affects our body last week, and today we are talking about breaking the silence on mental health. So we titled this particular presentation today on this topic, and that is exactly where we live, where we find ourselves. And people sometimes hide these things closed door. They're dismayed with faces, and people feel like if it is exposed out there, people will make mockery of people. So at the end of the day, you notice that people die with mental health, people live with mental health, and they depreciate on a daily basis because they don't want to disclose them. So we'll be looking at a few things today. Once again, welcome to our program. If you are there, you can get your pen and paper, check down some points as we'll be going along. Over the next 60 minutes, almost, as you may be aware, this is a 1-hour program. We are going to talk about mental health, what it really means, why it matters every single person in our community. We're talking about young people, men and women, students, workers, and what you can do to protect your minds and support those you love when it comes to mental health. So stay with us. When it is time to call in, we encourage you to call, and we appreciate that. Share with us your stories. Maybe you have some stories. Field Health Hour, we are breaking the silence together tonight. So, in continuation of topic, let's look at what is mental health. Let us begin with the foundation. What is mental health? Many of us hear this term, mental health. We think immediately of madness. When we hear the word mental health, the first thing that comes to mind, many of us, we thought of madness or someone in a very bad mood in terms of how they do things, but that is very narrow and frankly incorrectly understanding. When they talk about mental health, it doesn't mean someone who is mad altogether. Mental health has stages, and there are a lot of disorders that lead to that. So for us to look at mental health tonight, let's look at the World Health Organization, how the World Health Organization defines mental health. They define it as a state of well-being in which every individual realizes their potential, can cope with normal stress of life, can work productively, and is able to make a contribution to their community. When your mental health is normal, you are 100% correct, because you cope with society, you are very productive in your society, you work with others, you analyze issues with clarity and distinction, you understand yourself, you take decisions that help society, that help yourself, that help your neighbor. So World Health Organization define as a mental state of well-being. So mental health is not just about illness. Once we hear this word, we should not first of all think on illness. It is about wellness. When we talk about mental health, it is about wellness. Think of physical health. You do not only visit the doctor when you are sick. Like some of us, we go for checkup on a monthly basis. Some people will not wait until they are sick. So you try to eat well, sleep well, exercise. Mental health is exactly the same. It is something you nurture every single day. So now I want you to think about this, all of our listeners. And I want to know, have you ever felt so overwhelmed? One may say, yes, I have. If you have felt overwhelmed that you could not think straight, then mental disorders are coming. You are not thinking, your thinking capacity is getting somehow questionable to yourself. And sometimes you had a day when you felt completely empty inside. You appear very forgetful. You notice that you feel of there is nothing within. It could be decision making, it could be positive thinking, and etc. If you feel that way sometimes, and even when everything on the outside looks fine, but inside you feel that there is nothing there. Or have you ever lost sleeping appetite? Some people don't sleep well. They lost the appetite for sleeping altogether. They lost the appetite of eating altogether. Don't overlook that. It also contributes to mental disorder, mental health effect. So I want for us to look at mental health on the broad perspective. It affects how we think. Once your mental health is affected, your thinking will also be affected. How we feel, your feeling will also be affected. How we act, the way you act, you react to situations, it will also be affected. How we relate to others, everything is just connected together. Once you are affected upstairs, definitely the way you relate to other people will also be affected. And how we handle stress, you are not going to normally handle stress anymore. Your mental health is challenged. It shapes every area of our lives. When we are mentally distressed, every area of our lives, even our family, they will be affected. Our work, the work we do will be affected. Our community, where we live, our environment will be affected. And yet, let's bring it down to Liberia and across Africa. Mental health remains one of the most neglected areas of health. In Liberia and West Africa, mental health, if we look at it, you get on the street today, like here in Maryland County, specifically Harper City, you notice that a lot of young people are in the street, they are mentally ill. So it has been noticed that mental health is mostly neglected in our societies, especially in Liberia and West Africa. People are not really paying attention to mental health. So it is something that once it is not being paid attention to heavily, we face too many problems with it. Maybe you are in a place where the government or the citizen, the health facilities, the health institution prioritize mental health. Like what we talk about Liberia, it is not really focused on, and in other part of West Africa, it's not focused on. But if you find yourself in a country where the institution or your government, your health institution focus heavily on mental health and mental disorder, you notice that people will not actually be affected too much. And then it also creates room for people who are already like willing to be mentally rescued. They will be rescued because they already have people who want to save them. They have institutions that are focusing on them. So perhaps in your home, your church, your workplace, a person is carrying something heavy that the world cannot see. Mental health. And here is what makes today's conversation so urgent. This particular edition of Field Health Hour. What makes it so urgent? In Liberia, the effects of decades of civil conflict, poverty, unemployment, and social instability have placed our wounds. And then we in Liberia, those of us who live in this country as citizens, due to poverty, due to our civil war, unemployment rate very high, social instability. It places our community under numerous psychological pressure. All these things that I just listed to you, it has placed our community under psychological pressure. Our people carry wounds. We ourselves, there are a lot of wounds that we carry in mind, in our thinking, on our body, due to poverty, due to conflict, due to war, due to unemployment. We are carrying wounds, generational wounds. These are things we carry, and we do not talk about them. That silence has a cost. People are carrying wounds with them. Some are committing suicide. Some have lost hope. They don't know where to go, what to do any longer, just because of what we just listed. So today we talk, we shine the light, and then we break the silence. That's why Progressive Health Initiative of Liberia decided to bring this weekly program called Field Health Hour here on Radio Cape Palmas. We will talk together, we'll share ideas, raise the awareness, and break the silence together. So now let us talk about specific conditions that are very common in our communities, conditions that many people are living with right now without knowing what to call them. People are living with those conditions. One of them, the first one we'll look at here, is depression. Depression. People are living with depression today, and it is a bad condition. People are living with it, but they don't know what to do. Some don't know what to do at all. Depression is more than sadness. It is a persistent feeling of hopelessness. When you are depressed, you are hopeless. A feeling of persistent, always continuous feeling of hopelessness. Emptiness. When you are depressed, you feel empty. A loss of interest in things you once enjoyed. Things that you found favor in before. Things that you enjoyed before. You lost hope in them. You lost interest in them. It can make a person feel tired all the time, unable to concentrate, unable to eat or sleep too much. In severe cases, it leads to thoughts of harming oneself. Once you are depressed to a certain level, you feel of even taking your own life away. You feel of committing suicide. It brings a thought to people to harm yourself. Depression is a medical condition. It is not weakness. It is not a spiritual failure. It is not an illness. It can be treated. Depression is a medical condition. It can be treated. So this is one of the conditions we want to look at tonight. Then we look at anxiety disorder. It's also part of mental health. Mental disorder, anxiety disorder. Let's look at anxiety. What we mean by anxiety? Anxiety is worry that is excessive. A worry that is excessive, persistent, and difficult to control. You worried, and that worried, you cannot even control it. It's very persistent. Every day you worry a lot. Very excessive. It's persistent. It comes to you every day, every minute, every second, and you cannot control it. We all worried. Worrying is normal. Everyone can worry. But anxiety disorder is when the worry becomes so intense that it interferes with daily life. When your worriness is interfering with your daily life and it is so intense, it becomes anxiety disorder. It is also a mental health issue. The person you will feel constant fear. You who have this anxiety disorder, you feel constant fear. You sweat too much. You cannot sleep, and to avoid situation because of fear, you worry. This is more common than we realize, especially among young people and women in our communities. So normal worrying is different, but anxiety disorder is a worry that is very intense, that makes you to even lose concentration, and then you cannot even be involved into activities any longer. You are afraid. You only sit every now and then very sad, and you appear very much sad, and at the end you even think of harming yourself. That's anxiety disorder. Then we look at post-trauma stress disorder. The post-trauma stress disorder, which is the post-traumatic stress disorder, we call it the PTSD for short. If we bring it down to Liberia, where we find ourselves, given our country history, this country history, this one is particularly important for us. This post-trauma stress, this post-traumatic stress disorder, the history of this country, 14 years of civil war, and other bad things that happen that play on the minds of people, on the mentals of people, the intelligence of citizens. We have gone through all these things. The PTSD, it developed after a person experience or witness a terrifying event. When you witness a terrifying event, for example, sometimes some people will just maybe go off suddenly when they see something very terrifying happen in their surrounding. Maybe it could be an accident, it could be a fight, it could be a war, and other things. It brings post-trauma stress. So this is a terrifying event like war, like violence, like sexual assault, loss of a loved one under traumatic circumstances. When you lost your loved one under these circumstances, it also creates the post-traumatic stress disorder. War can also bring that to us. Sexual assault or sexual abuse, when you are sexually harassed as a female or as a male, it also affects you. And then violence can come in many ways. It could come through fighting, insult, and other things. It also creates the post-traumatic stress disorder. The person, they re-experience the even through flashbacks and nightmare, feels emotionally numb, becomes easily settled. So maybe like the 14 years of civil war we experienced in this country, other people who went through all these things, that particular 14 years they were alive, and they experienced from year 1 to 14 years. Sometimes when they're sick, they think of the war through a flashback. Sometimes they dream about the war. It also brings this post-traumatic stress disorder. It is not good for us. And in our country, especially Liberia, this particular aspect of mental health, post-traumatic stress disorder, it is very much at high risk in our country because we experience lots of terrifying events in this country, and avoiding anything that reminds them of a trauma. Many of our elders and war survivors carries this without a name for it. Today we give it a name. Many of the people who survived the war here in Liberia, we are not going outside Liberia. This post-trauma disorders, people carrying it today because of what they experience. Let's look at another one which has to do with substance use and mental health. We discussed it last presentation, last Wednesday. This one is close to home for many families. We talked that. We said substance abuse starts from home, right, among family members. People who are struggling mentally, they turn to alcohol, they turn to drugs or other substances to cope with pain they cannot express. Some people, when they are stressful, when they are lonely, when they are sad, they don't want to discuss it with any other person. They feel that substance use is the only way they will feel somehow relief. That's the only way they will feel good. So you will notice that they are going to take in substances in order to relieve their body instead of expressing to other people. Instead of informing people to find solutions to those situations, they turn to substances and put them in, and just take them, consume them into their body. But substance use worsen mental health condition over time. We want to be clear with it. That's why we have come here once you are stressed off, your alternative, your option, your next action should not be to take substance into your body for relief, because it worsens mental health conditions over time. Once you do these things, you harm yourself, you affect your body, you kill yourself slowly, and it worsens your condition. It is not going to reduce what you are going through. It is not going to solve your problem, but it worsens it a lot. It creates a painful cycle. You will just continuously be experiencing what you previously experienced for which you took these substances, and it will worsen and give you a painful cycle. And then what happens? The person uses to feel better, but the substance makes the mental condition worse. Maybe when you were sad, at least you have a little bit good feeling there, but now the substance you put there, it has worsened the condition, and it make it more worse, and it drive more problem to you, and break that cycle. To break such cycle, it requires addressing both the substance and the underlying mental health needs. So like we talk about substance abuse and mental disorder, the both of them, you have to work them out together. You have to work them out together. So to our listener, if any of these descriptions sound familiar, whether for yourself or for someone you know, please do not ignore it. Awareness is the first step to healing. Awareness is the first step to healing. This is why every week Progressive Health Initiative of Liberia Field Incorporated appear on Radio Kipamos here at about this time to just give awareness on some of those basic health problems, because awareness is the first step to healing. Mental health conditions are not punishment. Nobody should tell you that. They are not punishment. They are not cursed by no one should tell you that mental health conditions are caused by curse or witchcraft. No, they are not caused by they are not curses on human beings, or they are not witchcraft activity. They are health conditions. Mental health conditions are health conditions. They are caused by a combination of biological, psychological, and social factors. Mental health conditions, they are not curse. They are not witchcraft activity. They are not, some ones may say, African sun. No, they are health conditions. Let's get it clear tonight. They are caused by the combinations of various factors, like biological factors, psychological factors, and social factors. And like any health condition, they respond to care. Mental health can respond to care. It can respond to support, and where necessary, professional treatment are given. So you can be healed from a mental disorder. You can be healed from mental conditions. Let's look at the stigma in this, or in our segment 4. Let's look at stigma. Why we stay silent? Why people nowadays suffer in silence for years? The answer. Let the answer be given tonight. We see some people who suffer with mental condition for years. They are silent. They can't tell anybody. Stigma is when person is seen as lesser. Maybe you feel the person is mentally ill, so you degrade them, you denigrate them, you insult them, you talk to them anyhow, and then the stigma is there, so that person feel that they are lesser, they are no one in society, as dangerous. They see themselves as lesser. They see themselves as dangerous people. They see themselves as shameful. Some of them even feel that they are crazy because of the health condition. In our community, the stigma around mental health is enormous. There are too many stigma when it comes to mental health. People are afraid of what their neighbors will say. Like if you are mentally ill, you're afraid of what your neighbor, your close door neighbor, what they will say. Parents are afraid their children will not get a husband or wife. Workers are afraid of losing their job, so they hide it. They pretend, they suffer quietly. These are reasons you see people stay with silent. They stay with mental health for a very long time, and they are silent because they feel if I'm working, if I say out, I will lose my job. If I'm looking for a woman, I want to marry. If I say out, I will not get any woman to marry. If I'm looking for a husband to marry, if I say out, no man will come around me to get married to me because I'm mentally ill. So at the end of the day, people feel that once they are mentally ill, they will keep silent, because if they're having to share with any other person, even in their community, people will use stigma against them to make mockery of them, to laugh at them, and they will appear so dangerous, lesser in society. So you notice that people keep these things to themselves and then suffer for a very long time. Community sometimes makes it worse. Even our community we live in, when someone is struggling, how many times have we heard people say these things? That one is mad. Maybe you see somebody suffering from a mental illness, you don't even know the beginning, where it starts from, but you just say the person is mad. Sometimes we hear people say the other person need deliverance. Sometimes what they say, these are all stigma. We sometimes, if somebody have mental illness, some of us will just conclude, say, because of bad company, this person is suffering from this particular mental problem because they have bad company. Even when we can say this thing sometimes with a malice, and sometimes we say it without a malice. We push people further into silence. Those statements, they can push people into silence. People who want to disclose certain information, certain health problem to people, it pull them back to silence because of what we say to them. So it is not, these things are not advisable. Before you make any statement against somebody who has health condition, there should be a proper investigation. Probably you go close to the person explain to you what is happening to them, and it is not even good to explain to other people about another person's health problem. A person who is not a health practitioner, a person who is not a counselor. You just talk about somebody's health condition because you see them into that. It will stigmatize such person, and it will make them to stay away from even health facility, and they will keep silence. So people who are asking for help today, when we say this statement, for them to even ask for help, it looks dangerous to them, because they will say, I'm not going to tell my brother this, my story, before it escalates to a different level. So I want to say something very clear today. Seeking help for mental health is not sign of weakness. Those of you who have it, what we would like to provide awareness on, and to also give little advice on, is that you can meet your counselor, you can meet your trusted person, your trusted friend. It could be your pastor, it could be a health practitioner, or you visit a health facility. But seeking help when you are mentally ill is not a weakness. It is one of the bravest things a person can do. Don't be afraid of losing your job. Don't be afraid of losing friends. Don't be afraid of losing your relationship, because prevention is better than cure. We always say this: prevention is better than cure. Just as you could not be ashamed to go to the clinic for malaria. When we have malaria, we can go to the clinic and get paracetamol and get other drugs. Why not we visit a hospital for our mental illness? You should never be ashamed to seek support for your mind, because once your mind is destroyed, definitely the body has nothing to offer. When you are mentally ill, it is bad. Psychological illness is very much bad to your entire body. So it is one of our parts that we need to actually pay keen attention to whenever we notice something that is very unusual. Stigma also has a community cause. When people cannot talk about mental health, family breaks apart. It breaks family apart. Young people drop out from school. Workers cannot perform. Community members who could contribute become isolated because of what? Breaking, just stigmatizing each other. The silence does not protect us. it cuts us apart. Everybody go away from each other because of mental health.